In about 20 minutes, the state's coronavirus restrictions will expire due to an executive order from Governor Tate Reeves.
Well, it's a decision that's been criticized across the country, including from President Joe Biden himself. And joining us today to talk about the decision by the governor to roll back our state's COVID restrictions is our good buddy, Dr. Timothy Quinn of Quinn Family Healthcare in Ridgeland. Dr. Quinn, thank you for joining us today. Good to see you again.
Hey, thank you for having me.
Well, the decision in Texas and Mississippi to ease COVID restrictions has been strongly criticized. So what are the dangers of letting our guard down too early?
Well, I've watched a lot of our experts, our national experts, medical experts, and I've heard a lot of different commentaries, but one example really, it caught my ear. And he explained it as someone that's trying to get healthier. Maybe they'll start eating more healthy foods, they'll start exercising more, and they'll start seeing results. Things will start getting better. This is not the time that they want to stop all these positive changes because they want to continue to do better. And he compared that to the coronavirus pandemic. Basically, the analogy was that we've been wearing our masks, we've been social distancing, we've been following all the guidelines of our healthcare experts, and we're getting better. Things are getting better. So we just have to continue and not stop, especially right now with these new mutant strains showing up.
Dr. Quinn, are you concerned that some communities in the state will just go completely maskless and not social distance and crowd into restaurants, etc.?
Well, what we have to do is we have to continue to provide good information to our communities through programming such as this. Just remind people that we're not out of the storm yet. Things are getting better, but we still have to maintain persistence with wearing our masks, social distancing, avoiding large crowds. I spoke with authorities with our Mississippi State Medical Association, and we're all together, the physicians of this organization of Mississippi, that we should maintain the understanding that we have to continue and push to get everyone vaccinated as soon as possible.
Well, now me and my wife have a disagreement on this. She says that it was too early to drop the restrictions. I countered by saying people have enough sense to do the right thing. And I've slept on the couch before, so I'll stick with that. But what about you, Dr. Quinn? What should we do? What's your advice on what we should be doing right now as individuals?
Well, what we should do is continue to follow the science, continue to follow the fact-based information, the research. And overwhelmingly, the research has demonstrated time and time again, wearing our masks, social distancing, avoiding large crowds, unnecessary travel not done. All of these recommendations by our healthcare officials, to include the CDC, with all of the fact-based information, with all of the research, this is what we should follow. And overwhelmingly in the scientific community, it's being totally agreed upon that we need to continue to follow these guidelines, and we just have to keep putting this information out there so when people do make their decisions, they're able to make well-informed decisions.
Just real quickly, are any of these dangerous variants showing up in Mississippi?
Yes, they're starting to show. Now, just note, the only way we can know about these variants is with sequencing, and that's a very detailed protocol that is being performed where they have to look at the virus, very, very technically, and we're not doing it as much as we should, but we're going to start doing it more so we can identify these mutant strains and have more information on where we are and where we need to go. But we do know we need to continue to follow those guidelines.
Dr. Quinn, one of my colleagues was at the dentist today. He said his dental hygienist was so excited. She's going to get the Johnson & Johnson vaccine. Next week, she's having to go to Laurel to get it, but she's going to get it. Very excited about that. Of course, that's the one shot. This is just great news, isn't it, that people that's coming in and that they can get this one?
Most definitely, because the opportunity for someone to get very substantial protection against coronavirus with just one vaccine, that's going to be phenomenal, because that means we'll be able to vaccinate so many more people. And like I said yesterday, that's another weapon in this arsenal that we have now in Mississippi to fight against this coronavirus pandemic.
All right, let's all hang in there and keep these masks on and do what the scientists say to do. Thank you so much, Dr. Quinn. As always, such a pleasure to have you with us.